And once again, really want to welcome everyone to a very important webinar about cyber attacks and the healthcare system. Again, this webinar is sponsored by the Region 1 Regional Disaster Health Response System that is funded by ASPR, the Administration for Strategic Preparedness and Response within the Department of Health and Human Services. We have three extraordinary speakers we're so grateful to have. We have Deputy Director Nitin Naranjan with the Cybersecurity and Infrastructure Agency of the U.S. federal government. We have John Riggi, who is the first National Advisor for Cybersecurity and Risk for the American Hospital Association. And we have Deputy Director Brian Mazanik, who is with the Office of Preparedness within the Administration for Strategic Preparedness and Response, ASPR. So I will introduce each of our speakers as we go through them, and I'm going to start with Deputy Director Naranjan. Nitin Naranjan was appointed as the Deputy Director for the Cybersecurity and Infrastructure Agency, which also is known as CISA, on February 16, 2021. Prior to joining CISA, Deputy Director Naranjan served in a variety of public and private sector positions spanning over 30 years. Most recently, he has served as a consulting firm executive, providing subject matter expertise on a variety of national security topics. He has held a number of federal government roles, including Deputy Assistant Administrator at the U.S. Environmental Protection Agency, the Director of Critical Infrastructure Policy at the U.S. Health and Human Services, overseeing healthcare and public health programs. We're really extraordinarily grateful for his participation, for the perspective and experience that he brings to us. So I will turn it over to Deputy Director Naranjan.
Great. Thanks, Paul, and good afternoon, everyone. It's great to be here with all of you today and talk about, I think for me and my background, where two of my worlds collide as we talk about cybersecurity and healthcare and bringing those two worlds together. I want to talk briefly. I know I promised Paul I'll leave my comments about 10 minutes because I could talk about this for hours. Talk about CISA's mission and a little bit about what we're doing in healthcare. And I know that John and Brian are going to provide additional details. CISA, the Cybersecurity Infrastructure Security Agency, is responsible for the protection of the nation's critical infrastructure across 16 critical infrastructure sectors, of which the healthcare and public health sector is one of them. Those efforts are led by what we call a Sector Risk Management Agency, and HHS serves in that role. And they work very closely with partners in the public and the private sector, including groups like the American Hospital Association, to make sure we are bringing in the private sector into our discussions about preparedness, prevention, as well as resilience and response to both cyber and physical incidents that may happen across the nation. At the end of the day, CISA is an agency about partnerships. This is not something that we can do alone. As we look about the protection and resilience of our nation's critical infrastructure, this cannot be done solely by the federal government. Frankly, this is not even just a national solution. This is an international solution. It's something that we work with partners all around the globe on to make sure that we are working together to protect ourselves from common adversaries. And I'll talk briefly about the threat landscape. But we recognize that we are seeing a change in that landscape as it pertains to the healthcare public health sector. We want to make sure that we're all doing our part, because I truly believe that everybody has a role to play in this, and we need everyone to play their role. The global threat landscape, when we look at this from a cybersecurity perspective, has changed, I think, in two ways that are most concerning. One is we're seeing a change in the adversaries landscape. We're not just dealing with nation states. We're not just dealing with Russia, China, Iran, North Korea anymore. We're facing nation state threats as well as cyber terrorists and cyber criminal organizations that wish to cause harm. So we're seeing that change and that pivot globally amongst the adversaries that we're all up against. Similarly, we're seeing a change on the victim landscape. That's also concerning. We're not just seeing attacks against large organizations and large cities or large federal departments and agencies and large companies. We're seeing attacks against small businesses. We're not just seeing attacks in urban centers, we're seeing attacks in rural America. And we're seeing attacks against sectors, arguably, that in the past were somewhat protected, shall we say. Even if we go back in kinetic warfare, going back centuries, we never bombed the tents with the Red Cross on it, right? We always treated healthcare as a protected kind of separate entity. We don't see that protection anymore when we're dealing with the current adversary landscape. We're seeing hospitals being attacked by ransomware, hospitals being attacked by other partners through other attack mechanisms, DDoS attacks and others. So, that protection is no longer there. So that change in the victim landscape, as well as a change in the adversary's landscape, to me is what's most concerning. And as we look at the number of attacks we're seeing in the healthcare sector continue to rise, it becomes even more critical. If we combine that with what we're seeing from the PRC and the threat that we're looking at coming from the PRC, we know that a lot of what they're trying to do is beyond, frankly, the scope of intelligence collection and espionage. They are looking to disrupt the daily lives of Americans. They're looking to have societal impact, and that a better way to do it than to impact healthcare facilities and have people lose that trust and that confidence in having access to healthcare during a time of crisis. So we are seeing that pivot, which is concerning to us. I would offer, we're seeing this in healthcare, but we're seeing this in other sectors as well. We're seeing attacks on water utilities. We're seeing attacks on K through 12 schools in urban and rural America. Last year in FY23, CISA identified 4 sectors of primary concern that we're focused on, 4 priority sectors. There were election security, K through 12 schools, water and wastewater, and healthcare and public health. And that has continued into 24, and it continues to be a priority sector of ours. And for good reason. We also want to make sure that people truly understand the risks that they're facing as we talk about cybersecurity threats to healthcare organizations. I think often in healthcare organizations, back when I was in the hospital space, I think there was a perspective that people just felt our CIO is handling this, our CISO is handling this, we don't have to worry about this. And I look at risk as a 3-legged stool. And we spend a lot of time in our organizations talking about risk identification. We spend a lot of time talking about risk mitigation. What we don't do is talk about that 3rd leg of the stool, which to me is risk acceptance, right? Any risk we have identified and we have been unable to mitigate, we are accepting. We accept risk every day. There's nothing wrong with that. It's part of our day-to-day lives. But I wonder whether organizations truly know the risks that are being accepted and at the levels in the organization that should be accepting that risk, i.e. CEOs and boards of directors, senior elected officials at the state and local level. And so what we want to do is really look at what we're calling corporate cyber responsibility and ensuring that those individuals within the organizations that truly are the risk acceptors are accepting the risk and understand the risks are being accepted by choosing to mitigate or not mitigate. We'll never mitigate everything. We'll never get rid of every vulnerability, but we need to know what risk we're accepting. This is both in steady state and what we're doing now, as well as, frankly, something I've been talking a lot about is during M&A. And we see a lot of M&A in the healthcare space. We talk about financial health of an organization that we may be looking to acquire. Do we understand the cyber risks that we're bringing into our organization with that merger? Do we understand what their position is? I know I've talked to some healthcare systems that they're having these conversations, and they're making determinations of we need to invest $1 million, $10 million to get their cybersecurity posture into where we would want it. And they're building that into their plan. Others are not even having conversations. We need to really look at risk from that corporate perspective. We need to understand what we're buying and what we're bringing into our ecosystem. So we have a huge effort underway called Secure by Design and Software Bill of Materials, where we want people to know what you're buying, know what technology you're bringing into your institution, understand the vulnerabilities of that technology. We think technology is great. We're going to see a lot of continued evolution in technology in the healthcare space that we're really excited about. But we need to understand the vulnerabilities that those tools and resources are bringing in and make sure that we're building that into our calculus from a cybersecurity perspective. 2 things I'll close in. One, CISA started a new effort last year called the Pre-Ransomware Notification Initiative. And this is an effort for us to continue to move left of an incident. So we do a lot of work with organizations after something happens or after they're perhaps locked up from a ransomware incident. What we want to do is move left and be able to prevent a lot of these from happening. So we stood up an effort last year where we worked with academic researchers around all over the globe to identify when an adversary is essentially already on your network. So they are positioned and able to perhaps to lock you up with a ransomware attack. They have just chosen not to do it yet. And we're able to make notifications to organizations to say that they, that you need to take these mitigation steps to disconnect your network or to prevent yourself from being locked up. We did over 1,200 of these notifications in the United States last year. We expected to do several dozen. We ended up doing over 1,200. over 10% of those notifications were in the healthcare sector. Over 156 notifications were made to healthcare entities around the country that were about to be locked up by ransomware actors that we were able to prevent. And we were only able to do that because people took our call. And they took our call on evenings and weekends. They took our calls in the middle of the night. We had one organization on the East Coast, not healthcare, another sector, that didn't take our call on a Friday night, and they were locked up by Saturday. They did call us on Saturday, sadly. So, we do have efforts underway where we are trying to prevent more of these types of events from happening, and working with partners such as everyone on this call and your colleagues around the nation. We want to continue to push in that preventive space as well where we can. And the last thing I'll end with, as I always make a plug for, is our regional teams. So CISA has regional staff throughout the country. We have cybersecurity advisors, protective security advisors, election security advisors, and emergency communications coordinators that work with all 16 critical infrastructure sectors. Work closely with the regional teams that Brian has out in the field as well, and work closely with hospital associations throughout the nation. So we have local resources on the ground that can help you navigate this space. I know it's hard for us inside the Beltway to navigate the federal government. It's even harder, I think, for people outside the Beltway to navigate the federal government. So if you haven't built a relationship with your regional staff, we encourage you to do so, and they can help make sure that we can get the connections not just into CISA, but into the broader federal family as well. If you have a great relationship with your ASPR regional staff, they know how to contact us as well. So we really want to make it easier for folks to reach us in the federal government. Similarly, we all work closely with our colleagues at the Bureau and other great federal partners, and we want to make that one-stop shop that you've called one of us, you've called all of us, and we have the ability to bring those resources to bear. So with that, I'll end it there. I appreciate the time.
Well, thank you so much. There's so much great content in everything you said. I think, there's a lot of work that hospitals and healthcare organizations have to do if, God forbid, they get that phone call from you that someone's already within your system, to be able to take action effectively and quickly, and do so without compromising clinical operations at the same time. And so I think it's just great to know that that's a service or an opportunity if the worst is happening. But again, I definitely, for our audience, want to make sure that folks understand how much work each organization has to do to be ready. And couldn't agree more on the regional partnerships as well. I think the CISA advisors, the regional ASPR representatives that are available are just extraordinarily helpful. So we're going to move on from those great remarks to our next speaker. We're really excited to have John Riggi with us. John has spent nearly 30 years as a highly decorated veteran of the FBI. And as I mentioned, he serves as the first national advisor for cybersecurity and risk for the American Hospital Association and their 5,000 plus member hospitals. John is able to leverage his extraordinary experience with the FBI and the CIA in the investigation and disruption of cyber threats, international organized crime, and terrorist organizations to be able to assist on policy and advocacy issues and provide trusted advisory services for the nation's hospitals and health systems. His trusted access to hospital leadership and government agencies enhances his national perspective and ability to provide uniquely informed risk advisory services. And he has had a direct role in assisting multiple ransomware victim hospitals and health systems post-attack. So again, extraordinarily grateful for John's participation as well. John, let me turn it over to you.
Thanks, Paul, and thanks to Nitin and Brian for being here. As Nitin mentioned, this is really a collaborative effort in terms of trying to mitigate the cyber threats that we all face as a nation and as a sector. As we have seen, unfortunately, ransomware attacks and other types of cyber attacks against healthcare have increased pretty dramatically, especially in the case of ransomware attacks. According to HHS own figures, these attacks have increased over 300% just in the last several years. So again, great collaboration. It's not just only a whole of government approach, but clearly a whole of nation approach to try to help mitigate these threats. And Nitin and Brian, not only colleagues, but they're friends. And whenever there's a big event, we get on the phone and talk to each other and help each other understand what's happening and how we might contribute to the government's understanding of the impact of these attacks and help amplify threat intelligence published by HHS, CISA, and the FBI. So as Nitin alluded to, that there are huge geopolitical strategic threat issues which are contributing to the rapid increase in cyber attacks against healthcare. Also, as Nitin mentioned, the previous norms of not attacking healthcare, even in times of kinetic warfare, have gone by the wayside by these groups. In particular, the ransomware groups, which are primarily based in Russia and operate at least at the pleasure of the Russian government, if not at the direction, have increased pretty dramatically. Folks always ask me, based on my previous government experience, and I'm at liberty to talk a little more freely these days, being on the private side, is why is this happening? How is it that these attacks have increased so dramatically, and why is it that they're based in ransomware groups primarily based in Russia? And the simple answer is that the Russian government does not cooperate with U.S. law enforcement in these investigations, and ultimately it's in their interest to allow, at least tacitly, to allow these groups operate and attack the West. It's in their interest to keep us on our heels, in a sense. So last year, unfortunately, was the worst year on record for healthcare cyber attacks against U.S. healthcare. Data theft attacks were up about 400% since 2020. We had about 585 hacks. The number of hacks has remained fairly constant, but the number of individuals impacted by these hacks, again, have quadrupled since 2020. Last year, the healthcare records of 126 million Americans were stolen or compromised by these foreign-based hacking groups and ransomware groups. We estimate about a third of those attacks were actually ransomware attacks, which were accompanied by data theft attacks. The trend that we have seen that has amplified these types of attacks is really a couple phenomena going on. One, the adversaries, again, are allowed that safe harbor to operate from our non-cooperative foreign jurisdictions, but also it's what I call this phenomena of what I call the democratization of ransomware. The rapid development of ransomware as a service is increasing the number of individuals who are capable of conducting ransomware attacks. Basically, you have the ransomware administrators, and they franchise out their ransomware to perhaps less capable hackers who they empower them to conduct these attacks. So you have a much larger pool of hackers conducting these attacks against the U.S. Healthcare records continue to remain very valuable. That's why they're targeting them. Why are healthcare records valuable? It's easy to commit all types of fraud with healthcare records, including insurance fraud. So that's a whole other discussion. Perhaps we have to work closer with our insurers to make sure that they do a better job at detecting and preventing fraud. But of course, the ransomware is the major issue that we're concerned about, because ransomware attacks against hospitals, we have seen over and over, disrupt and delay healthcare delivery, posing a risk to patient safety. The FBI and Department of Justice now classify ransomware attacks against hospitals as threat to life crimes. And the federal government overall has been very, very responsive when we call and indicate that one of our hospitals is suffering a ransomware attack. Nitin, Brian, whole team, the FBI gets on their teams together and respond very quickly. And the issue we have also seen an increase is that it's not just individual hospitals that are being attacked. The bad guys, primarily the Russian ransomware groups, have mapped our sector. They understand strategic third-party service providers that provide vital utility-like services to our sector. And yes, I'm referring to the United Health Group and Change Healthcare cyber ransomware attack, which just occurred recently, and we are still suffering from that loss of technology and the cascading effects. Bad guys figured out if they attack Change Healthcare, there would be a disruptive effect across the entire healthcare sector, and impacts we didn't quite even understand from the beginning. So not only were payment services, insurance claim submissions disrupted and reimbursements disrupted, but there were pharmacy prescriptions that were disrupted initially, and insurance pre-authorizations disrupted, really causing a very significant disruption across the healthcare sector. And that brings us to the point of we not only need to understand the nature of the adversary, how they're attacking us, how to defend against these attacks, but we also need to understand what is the cascading effects, what are the impacts of these attacks when they are successful. So we need to not only plan to defend, but we need to plan to respond to these attacks. And one of the ways that I suggest for consideration organizations start with this, as Mass General has done a great job with their IDART process, is really to understand, if you look at the clinical workflow, for instance, every step of the clinical workflow in every piece of technology that is used in every step of that clinical workflow, from admission of the patient to diagnosis to access to the electronic medical record, understanding the history of the patient, drug allergies, perhaps, ordering labs, ordering images, so forth. And think about what would happen if we did not have access to that technology internally, if our networks went down, or external cloud-based technology like Change Healthcare, if we lost the internet connection, or if in fact that third party was attacked and we lost their services. You know, things that Paul talks about all the time, and you're well aware of as emergency management professionals, redundancy and resiliency for every piece of technology that we rely on. That's not only business critical, but is life critical and mission critical. Again, as I always say to the leaders to help them understand, the hospital leaders, think about if we lost the internet, if your internet was disconnected from all your cloud-based providers for whatever reason, or you lost your internal network. 3 simple questions to ask. What will work? What won't work? And what is the plan? And what is the plan for each piece of technology to carry on care, to continue to conduct business? So in relation to that, we assisted the Joint Commission last year to publish an advisory, just pointing out those facts and using Mass General's great example of the emergency preparedness work that you've done there to really look at the clinical workflow, every piece of technology that is used. What is the downtime procedure for every piece of technology, every part of the clinical workflow, especially those mission critical third parties? There was a movement in healthcare to rush to the cloud. We felt, and for good reason, it did increase clinical and business efficiencies, but also transferred risk. It created a different type of risk, where that risk was based in the cloud. And again, if we lost connectivity, creates significant disruption to business continuity and clinical continuity. So just to summarize, we need to understand what the impact of these ransomware attacks would be, and perhaps plan for what I call the 5 R's: regional, readiness, response, resiliency, and recovery, the 5R concept, and really to take a strategic look at cyber risk, not only from the geopolitical side, but how that impacts the organization's enterprise risk, understanding cyber risk is truly an enterprise risk issue and not just an IT issue. So let me stop there and back to you.
Thank you so much, John. I think that's fantastic. There's going to be so much for us to follow up on in the Q&A for sure. And again, I'll just remind everyone, please do put your questions in the Q&A for the speakers. We will get to them shortly. But you know, I think one of the comments you made that's so relevant for this audience in particular is the regional nature that if one healthcare system, even one hospital, but certainly a bigger system, is affected by a ransomware or cyber attack, that has cascading effects across the entire healthcare system. That the resulting changes in patient demand, the throughput challenges are absolutely enormous. And we're definitely going to come back and touch on the third-party issues as well, which I believe Deputy Director Mazanik is also. So our third speaker, we're so excited to have him as well, is Brian Mazanik. He is the Deputy Director for the Office of Preparedness within the Administration for Strategic Preparedness and Response, or ASPR, within the United States Department of Health and Human Services. In his role, he helps lead the office responsible for all aspects of preparation for events such as disease outbreaks, natural disasters, and intentional attacks with chemical, biological, radiological, or nuclear weapons. And of course, within his portfolio is cyber attack readiness. Prior to joining ASPR, Brian served at the U.S. Government Accountability Office, the GAO, where he was the senior executive responsible for leading the agency's strategic warfare and intelligence portfolio. And he has led and managed numerous teams evaluating a variety of national security programs and activities related to biological and other emerging threats. We're really excited to have Deputy Director Mazanik here with us, and Brian, I'll turn it over to you.
Great, thank you, Paul, and appreciate the opportunity to be with you. Thanks to you and to Mass General for hosting this important conversation. And ASPR in particular, I should note too, is grateful for the opportunity to support conversations like this through our funding to regional emerging special pathogen treatment centers, the RESPTCs. Also want to, before I jump in, and I'll try to be kind of brief in my remarks, Nitin and John had kind of provided an excellent overview already, and really just looking forward to getting into the questions, but do want to nod to what they mentioned in terms of the collaboration and partnership here. They are both indispensable partners as we all work together on this, what is really a wicked problem in the healthcare sector, and just really very much appreciate their partnership and the chance to be with them today to talk with you all. In terms of my remarks, I just wanted to kind of hit three things fairly quickly before we get to Q&A. First, I'm just going to double down on and echo some of the comments that Nitin and John shared on the threat and how it's increasing for the healthcare public health sector. I'll speak a little bit talking about that third-party risk. I want to acknowledge kind of the elephant in the room with the Change Healthcare attack that we are still, frankly, navigating, and I think it really it crystallizes the importance of dealing with this. I'm also going to briefly orient to kind of the HHS and ASPR role and what role we play in the mix here, kind of who's who in the zoo. And then finally, just want to end on a reflection of what we, HHS, are doing to step up to meet this growing threat and highlight some of our recent and ongoing initiatives to elevate our game in this space. So first, I think, again, as Nitin and John both noted, the healthcare sector is subject to cyber attacks, continuing to be among the top targeted industries, depending which list and how you count. It's always in the mix, in the top three, sometimes at the very top. We in ASPR and HHS are tracking on average of at least 6 noteworthy attacks in a given week. And we obviously aren't seeing all the behavior. There's a lot we don't know that's happening as well. You know, why that's happening, I think, again, Nitin and John touched on this a little bit, but I think within the healthcare sector in particular, there's a lot of additional either perverse incentives from the patient care impacts and the incentive to pay ransom. So it's perceived, I think, as a sector that may be more inclined to pay, but also just the nature of fragmented healthcare institutions, all the interconnected technologies, legacy systems, network connected medical devices. It's for a number of reasons, it's a very ripe target for malign cyber actors. To focus on the Change Healthcare attack briefly, I do want to acknowledge it again. I think it's kind of the elephant in the room. We're in the midst of responding, and I'll give just a little background for those that aren't familiar. This one has gotten a fair amount of media coverage, but this is a major attack. I think the largest attack, significant cyber attack on the healthcare ecosystem in American history. We at HHS first learned about this attack on the same day Change Healthcare discovered it, February 21st, and recognized, although it was a little bit of a different kind of attack than we're typically focused on, which is more of the healthcare delivery organizations and hospitals directly, that this could have really cascading effects across the healthcare ecosystem. As with any attack, our first priority at HHS from day one was to really coordinate and facilitate efforts to minimize or avoid disruptions that would affect care. And again, minimize those patient impacts. With Change Healthcare, and again, this gets to that systemic or third-party risk, they're owned by United Health Group, and they manage essentially the back-end healthcare technology related to processing claims, billing, prior authorizations for prescriptions or treatment. And as we've seen through the incident, sort of their omnipresence in the healthcare sector, the massive role that they play has led to really extensive disruption as they've been subject to this, victims of this cyber attack. So in terms of our response, again, we've took this very seriously from day one, working very closely with John and Nitin and others, which we continue to do. We've been in regular contact with the United Health Group leadership, state partners, external stakeholders, trying to understand the nature of the impacts. feel like we're now playing a role kind of matchmaker as well, just connecting payers and providers, working through and triaging a variety of issues as folks try to reconnect and work through the impacts of the attack. We've also been very clear, and this goes up to and including the Secretary of HHS, who has been very directly involved in making our expectations clear to United Health Group, that they need to do everything in their power to respond quickly, ensure continuity of operations for all of their customers, and step up to the plate in providing resources. We also have used CMS, the Centers for Medicare and Medicaid Services within HHS, as a key partner. They're a partner in any cyber incident, given their role as one of the nation's largest payers for healthcare services. But in this attack in particular, they have really stepped up to offer a host of additional flexibilities in terms of both authorizations and things like that, but also accelerated payments. I think as of this morning, we've, through CMS, injected over $3 billion into the healthcare system to try to deal with the liquidity issues that this cyber attack has introduced. So that's a little more than I meant to go into on Change Healthcare, but really just wanted to foot stomp it. I think it's a great example of just the severity of the threat and how consequential it can be, and why cybersecurity for healthcare matters so much, particularly as this illustrates with systemic and third-party risk. So we need to do more. So what is ASPR and HHS's role? What are we doing as a department to step up here? So Nitin touched on this in the beginning, but there are multiple sector risk management agencies for each of the 16 critical infrastructure sectors. HHS is identified for the healthcare and public health sector, which is a really broad sector. It's not just healthcare delivery organizations, hospitals. It includes other aspects like United Health Group, the payers, Change Healthcare, those other entities that I just alluded to, among many others. It also includes public health, which is often not at the front of people's mind when they think about healthcare and cybersecurity, but is very important. So within HHS, the role of sector risk management agency is delegated to ASPR, which I know as a sponsoring organization, this talk many of you may be quite familiar with. And we execute the 6 statutory responsibilities as SRMA, but we do it as a team across the department. ASPR doesn't do everything. We're sort of the quarterback as SRMA, but a lot of our colleagues in CMS, as I mentioned, FDA from medical device cybersecurity, our Office of Chief Information Officer has a number of key programs. We coordinate across the department to bring all the different tools to bear. And that's something we've talked about more as we focus on enhancing our resources for the sector. We're really establishing ASPR as that one-stop shop to manage this information sharing across the department with our partners in industry like John, with the interagency, Nitin, CISA, FBI is a key partner as well. So ASPR kind of plays that role, just to orient you to our piece of the pie. In terms of where the department's going and where ASPR is going to step up to this and address this growing threat, we're enhancing the tools and resources we bring to the sector to support hospitals dealing with a serious cyber attack. We've been sounding the alarm on this threat too for a while, along with many of our peers in the interagency, Nitin among others. But we put out in light of that, sounding that alarm, we put out in December a new concept paper, we call it, that outlined our holistic strategy and approach to really step up our game and dealing with this threat. There are 4 pillars in that concept paper that really are focused on 4 challenges. The first is harmonizing cybersecurity standards. We find working with our partners in industry that there is real confusion over which standards to follow. There's a whole host of different sets of guidance, and they're not necessarily tailored for the healthcare public health sector. A second pillar in this concept paper is supporting the sector financially. Hospitals, especially those that are critical access or high need in other ways, they don't have strong financial balance sheets to make necessarily all the investments they need to do in cybersecurity. So we really need to support them more robustly. And the president's budget that was recently released included $1.3 billion requested for that purpose. So hopefully with our friends in Congress support, we'll be able to do that. The third pillar is strengthening accountability too. It's not just about providing resources and tools and standards to the sector, but there also needs to be an element of accountability through the HIPAA security rule and also other levers, regulatory levers that the department has. And then finally, just in general, improving and simplifying coordination. There's too many doors into cybersecurity when engaging with the federal government generally, let alone HHS. Within HHS, as I mentioned, there's a lot of different players. So we're in the process now of really establishing this front door through ASPR to all of those resources. And any one of these things, is a huge undertaking in its own, but we think holistically those four pillars come together to really represent a comprehensive, sustainable effort to improve cybersecurity resiliency in the sector. On that first pillar on harmonizing standards, towards the end of January, we did release voluntary healthcare public health cybersecurity performance goals, or CPGs. These were modeled in large part after the cross-sector CPGs that Nitin and his team at CISA have put out. We developed them in close partnership with industry, with John and others, with their input. And we view these as sort of a foundational, high-impact cybersecurity practices that everyone should be looking at. So I really encourage you to look at those and see if you can begin to implement them if you aren't already in your organization. To help raise awareness and build that one-stop shop, but also share the CPGs, we rolled out concurrently in January a new gateway website for the department for the way to access all of our cybersecurity resources. The current domain of that is hphcyber.hhs.gov. So if you go there, you can pull down the CPGs. We mapped them to other existing standards. If you're already very familiar with CIST, as many CISOs are, you can see how they connect. So there's a lot of interactive resources on that site. And we really think these high impact practices will go a long way to helping the sector. So I encourage you to check them out. Our focus going forward is going to really be aligned to those CPGs and building out additional tools, resources, guidance to help folks implement them. If you have any questions about HHS, what we're doing in this area too, I want to also note we have a new 24/7 monitored email, hhscyber@hhs.gov. We're using it a lot now as we navigate the Change Healthcare attack. A lot of traffic from small providers that we're receiving and triaging through that. But it's also a general avenue if you have any questions about things that we can offer or how we can help, or feedback for us as we try to improve. So I know I threw a lot out. I'll stop there and really just looking forward to the questions and discussion with my colleagues.
Thank you so much. Again, that was also just spectacular. Really appreciate everyone's amazing comments. We've got a lot of questions coming in, so I'm going to try and get through them as best I can. Nitin, I think maybe the first one is for you, and I might hybridize too. But one is, how can people make sure that CISA has up-to-date contact information for their organization so they can receive that phone call? And then maybe I'll piggyback on it to say, how is CISA otherwise partnering with industry to get that data about when a hospital or an organization might be targeted by ransomware?
Sure. So I'll do the latter first, because I think that leads into the into the notification piece. So we work with partners all over the world, and whether we're talking about academic researchers, we're dealing with foreign governments and their version of CISA and our counterparts throughout the globe, as well as all these partners within the United States, whether it's cyber defense organizations, federal departments and agencies, law enforcement, the intelligence community, and as well as others to kind of put together what that picture looks like. I think as we also get information in from victims, that's extremely helpful as well. It's why we encourage reporting and voluntary reporting to us, because one of the things we're able to do at that point is that if you are a victim of an attack and you let us know, our teams can work with you to get the technical information behind that attack and do two things. One, it's most importantly allows us to work back with industry, with the software manufacturers and developers, and come back to you with mitigation guidance on how you could help yourself. But also the collateral benefit is to the entire industry is that we're able to take that information to blind the victim's information and to protect that, but to get out more broadly general information that says we are seeing an attack from this group or in this mechanism. Here's the indicators of compromise. Here's the tactics, techniques, procedures we're seeing. here's the mitigation you need to take. Here's the way you can check whether you're also a potential victim. And here's a mitigation you can take to protect yourself as well. So the reporting to us is not about putting it into a magic federal government bookshelf that it just sits and endures for decades on end. But it literally is to actually mix that with information that we have from multiple sources, and to give back to not just the reporter, but to the sector what information is out there. As far as how we get in touch with folks if they are potential victims, we've done site visits at a lot of healthcare facilities throughout the country, going back 20 years, whether these are physical security assessments, that folks have invited us to, whether these are cyber assessments that folks have invited us to. We're invited often to a lot of different local healthcare consortium meetings and working groups. We've built relationships with organizations. So I think we typically use that. We'll try working with colleagues at the Bureau, members of the Sector Coordinating Council, associations that have contacts in these areas. So we'll usually try kind of a widespread to try to get contact if we don't have already a direct existing relationship with that organization, to make contact quickly. So it varies organization by organization. But in that mechanism, if we are blind calling, we do have security parameters built in where if we do call you blindly and you're questioning the call, which again, we always tell everyone to be a little bit suspicious when you get calls from the federal government saying we know something about, from somebody claiming to be the federal government saying they know something about your network, where we actually have callback capabilities. So our operations center using case numbers and codes and stuff that can allow for effective validation of those individuals. So we've tried to put mechanisms in place to allow for a timely engagement across the board.
That's fantastic. I think all of that's so helpful. There's obviously the saying everyone's familiar with, ideally you don't exchange business cards in the middle of the emergency. And this is a great example of how having those contacts ahead of time is so incredibly valuable for sure. I think the other point maybe, to underscore in your comment is as someone, who's involved in a health systems planning, it is so hard sometimes to get good details about what others have been through, what have been the changing tactics used by some of those out there. And to have CISA and the other government agencies as brokers who can, in a de-identified way, share what's happening, let us know how we need to be changing our tactics and preparedness is really important. I think the reporting by organizations that have been affected just benefits all of us in such an important way. John, maybe I'll bring the next question to you. I think first, please correct me if I actually have this statistic wrong, but I think my understanding is that the average amount of time that a healthcare system is down, not able to use its electronic health record or operations is about 4 weeks after a successful ransomware attack. And again, probably for hopefully everybody on this call, that's pretty terrifying to imagine being on paper for a 4-week period. But still, even with that data point, some organizations really still struggle to get that leadership support, that buy-in for really robust downtime planning to be able to deliver safe and effective care for that period of time if they've been compromised. Can you talk about ways that that healthcare organizations have been effective in getting the buy-in, or really strategies that are most effective in preparing for response if they've been compromised?
Yeah. Paul, you hit it on the head. It's a leadership issue. Ultimately, I view cyber risk, cybersecurity, the mitigation of that risk as a leadership issue. So helping the leadership and boards understand the impact of cyber attacks, bringing in outside experts, having folks understand, although I have to tell you, almost every CEO I speak to today, they don't need much convincing. They just read the headlines or talk to their colleagues and they see what's happened. Your point is absolutely correct in terms of getting that leadership and that culture buy-in and seeing the effects. And ultimately, the most effective organizations that I've seen at handling, addressing this issue of clinical continuity are those that actually designate a role, an individual that has overall responsibility to kind of shepherd each department, each function, each hospital's clinical continuity and business continuity practices. What we have seen is that when people talk in terms of business continuity, they generally think of that as an IT issue, simply focused on restoration of technology, but not really in terms of clinical continuity. And there's been somewhat of a bifurcation of emergency management planning and cyber incident response planning. So we need to blend those together, and then folks focus on clinical continuity. But again, what I also found effective is that in some boards, not only do I recount the stories of myself being there, but I bring in actual victims, fellow CEOs. I do a lot of panels across the country, and I bring in victims to talk about their experiences. And almost consistently across the board, the organizations that become victim of a high impact ransomware attack, it's 30 days just for the restoration of core systems, EMR, maybe some of the other ancillary systems, imaging, so forth, telemetry, and reconnection. There's so many things folks don't realize. Even for the reconnection process, the people that you're trying to reconnect to will want maybe attestation that you're safe to reconnect to. That might be delaying some of the issues. And again, having folks recount their stories, but ultimately making departments accountable and putting somebody in charge to do that. One large organization actually created a position of Chief Continuity Officer that reports directly to the CEO. Let me stop there. Back to you, Paul.
No, thank you. I think that is so incredibly helpful. And again, I think the farther and farther we get down the road of electronic healthcare, where we are, so many of our nurses, our physicians, others working in the healthcare space have never really operated effectively in a paper environment. And I think it is a struggle to get folks to appreciate just how different it is to try and deliver safe medical care, to keep operational throughput going, especially again for not just days, but weeks on end. So really, really important.
And John, if I
Please, Brian.
Paul, if I can jump in on John's point too, I do think as terrible as the statistics are and how the healthcare sector is targeted, it actually, the silver lining there is that it's increasingly, it is absolutely a leadership issue, and it's easier and easier to make the case as you look at the hundreds of millions of dollars that some of these attacks are costing big, well-resourced entities to respond. I think that we're hopeful that there will be an easier pitch, frankly, on investing in cybersecurity. And I would note too, on this preparedness front, and as coming from the Center for Preparedness within ASPR, I have to foot stomp this too, but when we built the HPHCPGs, and they're broken into essential and enhanced practices in both areas, basic incident planning and preparedness is a key element. Exercising that downtime procedures, those going to paper records, is a key best practice we see consistently, and those who are better able to navigate. Still takes weeks, significant impacts, even in the best case if you were as prepared as possible, but you can be much better off if you invest just a little bit upfront in developing those incident response plans, those capabilities, those roles and responsibilities, and then actually exercising them. And CISA and Nitin and his team offer a ton of resources to do tabletop exercises, to do all kinds of things in that space. And we partner with them in that. So would encourage folks to look into that.
Brian, and if piggybacking on that, if I just may add, the tabletops are so essential. Thank you for raising that. But multidisciplinary and leadership starting there. So not just a cyber-focused technical tabletop exercise, but having the CEO, chief medical officer, legal, compliance, clinicians, head of security, all in the same room. And as you walk through a realistic scenario, how a ransomware attack unfolds and the cascading effects, and suddenly becomes quite clear, often painfully clear, that organizations are not prepared to address all the cascading impacts of trying to operate to provide clinical care without technology. It's quite, once you have the CEO go through that, generally there is pretty wide open support, and especially even having a board member present during some of the exercises, I have found that pretty effective as well.
Yeah, that's all phenomenal points. So Brian, I'm gonna jump off on the last comment that you made there, that this it is getting, I think, easier and easier to get executive leadership to really understand the risk within healthcare. But as we touched on a little bit earlier, we are also more and more interconnected than we ever have been, right? You mentioned Change Healthcare, and again, please correct me if I'm wrong on this statistic too, but I think 50% of U.S. healthcare transactions have gone through Change Healthcare to sort of show the magnitude of the impact, and therefore, it's our own systems and the third parties, and there's a question in the chat about medical device companies, right? That we obviously are dependent on their vulnerabilities as well. And so, can you just talk a little bit about how ASPR, how the federal government is looking at that, and any strategies you have for healthcare organizations to really take that 360-degree look at risk with their third parties, with their device and software manufacturers, with the partners in their region?
Yeah, I mean, I think this is why it's such a challenging area, this sector. I mean, I'm sure Nitin has views on this. Every sector, I'm sure, is challenging in their own unique ways, but the healthcare ecosystem is just so complex with so many different pieces. It is hard, and I don't think it's frankly possible to be 100% invulnerable. It's a question of when you're going to be attacked, not if, because of that complexity. Yeah, in terms of what we do to try to grapple with that, I mean, we do support risk assessments. I think understanding your assets and thinking of third-party capabilities and things as part of that too. Doing a holistic risk assessment is a key part of bolstering your cyber posture. We do some strategic level work on that, working with Nitin's team and others. But we also offer some tools. We recently rolled out the risk tool. It's the risk identification site criticality tool. We had a previous version of it, which was basically a spreadsheet to help folks think about risk, which can meet some of the regulatory requirements there too. But we recently in the fall launched Risk 2.0, which is a much more dynamic web-based tool, totally free for folks to use, that allows them to look at their holistic risk picture. And it actually allows for connecting for a large hospital system or other entities. You can link together to begin to see systemic points of risk. And then another nice new feature of Risk 2.0 is you can also choose to share anonymized data with us at HHS. So we're hoping if folks elect to do that, we'll begin to also collect some interesting perspectives and data. But I would go back also and foot stomp the cybersecurity performance goals that we rolled out. That was based on a number of different data injects and analysis, and we feel like those 10 essential practices, 10 enhanced practices are the foundational starting point. If you focus on those, if you don't know where to start because it is such a crazy difficult problem with all these different vulnerability points, start there, look at these 10 essential practices, begin to, if you got those, that's a good starting point, and you can build from there.
That's fantastic. I think, it is a daunting area, I think, for a lot of folks who are trying to figure out what they should be doing and figure out whether what they're doing is consistent with best practice. So we will actually take some of those resources, make sure they're amplified through our RDHRS.org website. I really, as we're getting close to the end of the hour, I want to so much say thank you to Deputy Director Mazanik, Mr. Riggi, and Deputy Director Nataranjan. Just amazing content. There is a lot out there, and I mean, unfortunately, I couldn't agree more that the threat environment continues to increase and get more complex, and that the consequences, I think, are also continuing to increase. But the good news is there is a lot out there. There's a lot that we can leverage from ASPR, from CISA, from the American Hospital Association, and the resources that John brings to bear through them. So please, I encourage you to visit each of their websites. We will post those, as I said, in the RDHRS.org website to make it easy for attendees today. Kelly, if I can ask you to bring the slides back up. We just want to let everybody know that there are a couple more webinars coming from the RDHRS. Our next one is on Friday, April 26th, about pediatric readiness, and emphasize some of the key steps hospitals can take, whether you're a pediatric hospital or more commonly not a dedicated pediatric hospital, to improve pediatric disaster readiness. And, we do talk a lot about behavioral health consequences of disasters and behavioral health challenges, but we rarely focus on it as a main topic. So we're very excited to bring you a webinar on behavioral health and disaster response. So once again, I really want to thank our three speakers. I want to thank everyone for attending today. We'll post additional resources. We'll also post a recording of this webinar at www.rdhrs.org. Thank you all. I hope you have a great weekend.